Amy is a client that we've been working with recently. Amy has bipolar. She was diagnosed with it when she was in her 40s. She's 75 now, and she recently had a fall, which saw her being admitted to hospital. Amy doesn't have any family that lives locally, so it was suggested that Amy should perhaps access some home and community care services to assist her with domestic assistant tasks and also some social support. The care workers that supported Amy were starting to make some complaints about her behaviour. There had been no physical violence, it was more a verbal threats and aggressive behaviour, shouting and those sorts of things.
Leave, go away, go away.
And the service provider said that if this behaviour continued, they would have to look at withdrawing the services. Amy was quite upset about this, so she contacted QARTA and asked for support to talk to the service provider and try and, come to some solution.
I just don't know what to do.
Her case was allocated to me. I visited her in her home and informed her that she had a right to receive quality services and quality care, but she also had a responsibility to provide a safe work environment and to treat the staff with respect. Amy agreed with this, but then went on to tell me that there were reasons behind her acting this way. Some of that was related to the fact that she never knew who was coming into her home and when they were coming. Amy also said that she wasn't really happy with the social outing she was going on. She had raised this with the service provider, but she just didn't feel that they were listening and they didn't really take any actions to resolve this. Amy also suggested that, it may be her medication that could be influencing her moods. She'd gone on new medication since she'd been at hospital. So thanks for coming today, George. I arranged a meeting between Amy and her service provider, and I also attended the meeting to provide some support to Amy in raising her issues. At the meeting, Amy agreed to visit her doctor and ask for a review of her medication. The service provider also agreed that they would try and ensure that consistent staff members were sent to Amy's house. They also discussed the social outings and how they could make the outings more enjoyable and responsive to Amy's needs. It was a successful meeting. Amy's really happy with the services she's receiving now. She's got some consistent staff coming into her home, and she's really happy and has built a nice rapport with these workers. And she was also going out on social outings that she was actually interested in and met her needs. From the service provider's perspective, they were happy to continue the service and grateful that QARTA was able to play a role in this, because it meant that they could ensure that their staff were safe going into their work environment. It's been quite a positive experience, and they've reached a really good resolution as an outcome of having QARTA support them.